question. Will healthcare as a percentage of the economy and in percentage of the, as a contributor to the economy, be rising or declining in terms of the cost of healthcare over the next 10 years?
Oh, my guess would be that healthcare as a share of GDP will rise.
Will rise.
But over the past 4 decades, it's been skyrocketing relative to GDP.
So
and the rise will be much smaller relative to GDP over the next decade than it has been historically. So historically, I don't remember the numbers precisely, healthcare's been rising on the order of 3% a year faster than GDP, and I think it's going to be more like 1% a year faster over the next decade. So nobody really knows, but the best guess right now would be that the curve has been unambiguously and sharply bent for the last 3 years. That means that you're starting at a lower level and you're going to stay at a lower level. And the very great likelihood is that not only is the level lower, but the growth is going to be lower going forward. And so I do think when we in the United States get down on ourselves, and there's plenty, we've been talking about it, to get down on, we do need to recognize that somehow we've had 2 pretty unsung triumphs in the last few years. We've bent the curve on healthcare costs, which is something people have been trying to do for 40 years. And we're now on a viable path to being an energy exporter, which people have been talking about for 50 years. And those are 2 big things that American society has managed to do. They didn't come because of some single major masterstroke piece of legislation from Washington, but they are things that have happened, and they're really powerful things.